Okay. Dear students, welcome to this lecture on palliative and oncology nursing. And it is basically a 4 credit units course units that we are going to be going through. Yeah, you have already seen the Word documents of the lecture, and of course you have already seen what we are going to be doing during the course. Yeah, and so we want in this lecture we want to have an introduction of the same. Yeah, so please look at the video, listen attentively to what is being said, and then in case you have any questions, then we should be able to discuss when we meet face to face. Yeah. So palliative and oncology nursing, as you can see, the words they are basically 2 words in one. There is oncology and there is palliative. Oncology basically deals with the study of tumors, yeah, or cancers per se, while palliative is basically deals with the care of people with these conditions, these malignant conditions. It might not only be cancer, yeah, but there are other debilitating conditions that require palliative care. Yeah, so we shall be looking at that now. Moving on, we want to start with oncology, and whenever we talk about oncology, we talk about cancers. Yeah, whenever we talk about oncology, we talk about cancers. Yeah. Now, the word cancer, you know what it basically means, but we are saying that it is a malignant neoplastic disorder. Yeah. So in other words, it is malignant. Yeah. When we say malignant neoplastic, it basically means that with malignant, it basically means that it comes on its own and it grows very rapidly without control. In other words, you cannot control it. Yeah, and neoplastic basically means that it's an abnormality in the growth of these of the cells. Yeah. So in other words, we are saying that the cancer is that development within our bodies. Yeah, which we cannot control its growth. Yeah. And as you can see in the second bullet, it says that the cells lose their normal growth, controlling mechanism, and the growth of cells is basically uncontrolled. So they basically multiply or grow very, very fast. And as a result, they basically eat up all the nourishment. Since they are growing very fast, then they don't even have time to grow enough, yeah, or what we call to differentiate into different cells, yeah. So it basically means that they are uncontrollably growing and do not have time to differentiate. Yeah, and as a result, depending on where the cancer is, yeah, depending on where the cancer is, then it brings about several health problems. Yeah? Like for example, if it is within the lungs, yeah, you'll have issues like maybe coughing of blood. You'll have things like a hoarse sound, and all those things. Yeah. So if it is within the kidneys, then you have probably issues like issues with the urinary system, issues with the excretion, issues with maybe acid-base balance. If it is within the blood, like for example leukemias, you have issues with your immunity. You have maybe anemia, chronic anemia, constant anemia. So basically, the problem of this cancer comes, or its manifestations are seen in that system that has been affected by that cancer. All right. So the other thing that is worth mentioning that you should be aware about is the term metastasis. Metastasis. Now, Metastasis basically means the movement, yeah, of cancerous cells. In other words, they move from where they are supposed to, from where they are supposed, or from where they originated to different sites or to different places. Like, for example, if it originated within the lungs, then it will move on to other areas, yeah, other than the lungs. And of course, we are going to see that several routes through which these cancerous cells move from their original location to other sites. Now, of course, we are saying that the roots of metastasis, yeah, where or how do they move from one place to another? And there are basically three roots, as you can see, yeah, three roots. One, there is what we call local seeding, yeah, local seeding. Local seeding basically here means that basically the cancers, the cancers shed themselves within the local area. Yeah, they shed within the local area. Like, for example, if a cancer started here, if maybe this is the cancerous place, then it shed, the cancerous cells break off and then they shed to, to other adjacent areas, yeah, to other adjacent areas, but locally, yeah. So that is what we call, or that is what we refer to as local seeding, yeah. But we also have, because there is, movement of blood is always moving here and there, yeah. We also have blood, as a means of, as a means of movement. Yeah? So within blood, you have, you have blood, you have blood moving, and that what actually happens is that just imagine this is our blood vessel, yeah. Just imagine this is our blood vessel, yeah, and maybe we have a cancerous cell here, yeah. We have the cancerous cell here. So what actually happens since these blood vessels have tiny pores, or maybe at capillary level they are tiny pores into the blood vessels. So what actually happens is that these cells find their way through the blood pores into the blood, and as a result they move, yeah, they move with the blood. As a result, they move with the blood and therefore to other adjacent areas. Yeah? So that is how metastases occur through blood. Yeah? Now the other one is lymphatic spread, as you can see. Lymphatics, you know what lymphatics are? Lymphatics are basically those ducts that transfer lymph, or maybe tissue fluid that was not absorbed into the blood, and it is in the interstitial spaces. Yeah. So if it was not absorbed, then it goes back to the heart via the lymphatic ducts. Yeah. No. So lymph is actually a movement. Yeah. Lymph can also be a movement. So also something like that, yeah, because we have the lymphatic ducts, yeah, that transfer lymph, yeah, or the interstitial fluid that has not been able to be transported back to the blood system. And as a result, they also end up within the lymphatics, and they are taken to other areas where they further spread. So those are the three major ways of metastasis. In other words, that is how cells move, cancerous cells move from their initial place of development to other areas. Now, this diagram or this slide shows us the major or the main or the common sites of metastasis. In other words, what are those common sites or organs where we see these metastases. And one of them, we are seeing that for bladder cancer, it basically spreads around the adjacent areas. And we are seeing the lungs, we are seeing the bone, the liver, the pelvis, and and the retroperitoneal structures. Yeah. So those are some of the structures where bladder cancer can spread. And for lung cancer, we are seeing the brain and the liver because the liver is just adjacent to the lungs, and as a result, therefore, the metastasis would easily occur there. For brain tumors, we can see the central nervous system. For prostate cancer, we can see bone spine. Actually, with prostate cancer, it is quite serious that if someone has prostate cancer, or if someone is aged and then they start complaining of back pain, one of the indicators of prostate cancer is actually back pain. Someone is complaining of back pain, and they are elderly. So that is because these cells have spread to the spine. But we also have the lungs, the liver, and the kidneys, among other things. And you can see for testicular cancer, we basically have the lungs, the bone, the liver. In other words, the point to take home here is that these cells, wherever they are adjacent to, are the potential areas of spread. In other words, they spread to those adjacent structures. But also because of blood, they spread to other maybe distant areas because because of what we saw earlier. Blood is one of the medium through which they spread. Okay, now how are cancers classified? Because this is very important. Yeah, how are cancers classified? Now we have they can be classified as solid tumors. Solid tumors. You know what we mean by the word solid, yeah? And then they can also be classified as hematological. Hematological, yeah? So with solid tumors, these basically associated with the organs from which they develop, yeah? Like the example, breast cancer. Yeah, when you even touch, you feel a lump. In other words, you feel a solid, something that is tangible, solid. Yeah, and so with the other kinds of tumors. Yeah, and so you feel a solid, and as a result, those are referred to as solid tumors or solid cancers. We have hematological cancers. These ones come from blood, yeah, from blood, and originate from blood, cell-forming tissues, like, for example, the leukemias, lymphomas. In other words, these are cancers of blood cells. Like, for example, you can have cancers of white blood cells, what we refer to as leukemias and lymphomas, or even multiple myeloma. So you have those cancers of those white cells, and you end up with issues like leukemia. But also, it is worth noting or worth mentioning that once you have a cancer, maybe cancers of white blood cells, then you can have a wide range of signs and symptoms, because once these cells start multiplying rapidly, then they end up affecting even the other cells. Like, for example, patients with leukemia are often associated with having severe anemia. Yeah. And yet anemia has to do with red blood cells. Yeah. So in other words, we are saying that as you have maybe cancer of the white cells, yeah, then you can also have effects in the other cells. Yeah, exactly. That is what we are saying. Yeah. So basically, those are the two classifications of of cancers. They are solid tumors and they are hematological. Yeah, good. Now, the other thing we want to talk about is the staging and grading of cancers. Staging and grading of cancers. Staging. And grading. This is something that you probably do not, you really need not to over concentrate on it, because it is not you know, a very big issue, or very big, it's not a big deal, but you ought to know about it. What do we mean by staging, or what we mean by grading? These two words are different, as we are going to see. So we are saying that staging and grading are methods that are basically used to describe a tumor, and specifically solid tumors. Yeah, these are methods that are used to describe solid tumors. Yeah? Now, these methods describe the extent of the tumor, yeah, the extent to which a malignancy has basically increased in size, whether there are other regional lymph nodes involved, and whether there is basically metastatic development. So in other words, we are saying we describe them in terms of T and M, whereby T means T means the tumor itself, whether there is size in change of the tumor, whether there are, you know, whether there is involvement of nearby lymph nodes, and or whether there are metastases involved. Yeah, so that is basically how we describe the extent of a solid tumor. Now, grading a tumor classifies the cellular aspects of the cancer and is an indicator of tumor growth, rate, and spread. Yeah. So when we talk about grading, we basically mean you know, we are classifying a cancer to see the extent of its growth, rate, and spread. And then staging classifies the severity and clinical aspects of the cancer and the degree of metastasis at diagnosis. Yeah. So in other words, with staging, we are talking about the degree of metastasis at diagnosis, and with grading, we are basically looking at aspects of tumor growth rates and how far it has spread to other adjacent areas. Yeah. But so, in other words, the point to take home is that whenever we are talking about staging and grading, we are basically looking at the T and M, where T stands for the tumor size, then M stands for involvement of lymph nodes, and then A stands for metastasis. Has it basically moved to other adjacent areas? Now, grading basically is graded into four stages. Yeah. So with grading, we are talking about 4 stages. Yeah. We are talking about four stages here, from stage 1 to stage 4. Yeah, that is grading. Yeah, and of course, so with staging, we shall see that again. We are also talking about from stage 1 to stage 4. So we are going to see from stage 0 actually, yeah, to stage 4. So we are going to see what it actually means by grading and by staging. Now, with grade 1, yeah, when we talk about grade 1, we mean that the cells differ slightly from the normal cells. Remember, we say that a cancer basically is a malignant growth of neoplastic cells, yeah, and as a result, Remember, when cells grow, they are supposed to differentiate. In other words, they are supposed to specialize into their specific functions. Like, for example, if it is a skin cell, if it is a cell of the skin, then when it grows and subdivides, then it has to specialize into a skin cell. Yeah. If it is a cell within the lungs, if it is a cell within the central nervous system, it has to grow and develop, yeah, just like other cells within that particular region. Now, however, with cancer cells, what actually happens is that they grow rapidly. They grow rapidly and they fail to become like those cells that are in that area. In other words, they are saying they fail to differentiate. That is what we call differentiation. Now, when we talk about grade 1, it basically means that the cells basically they resemble those cells in that region. They resemble, and then they differ slightly from them. Yeah. In other words, they differ slightly from the normal cells and are well differentiated. Yeah. In other words, there is a mild dysplasia. In other words, there is mild, they slightly differ from the original or from the normal cells. That is what we mean by grade 1. And of course, maybe one thing that I should have mentioned is that oncology is a specialty in medicine, or it's a branch in medicine that basically involves specialists, people having specialized in the same. And in Uganda or elsewhere, they're actually called pathologists. Yeah, they are called pathologists. Or oncologists. Oncologists. Now, these are people that that study, you know, these are the people that study these changes in cells, and all those things. Yeah? They are called pathologists or oncologists. Yeah, oncologists, as you can see there. Yeah? So they study changes in cells. Now, so they basically get, we are going to see what it involves, but it involves getting a biopsy. They take a sample from that place that has a tumor, and then they put it over the slide, and then, you know, they examine it to see whether there are changes compared to the normal cells or compared to the cells in that area or that region. And so, so we are saying with grade 1, what actually happens is that the cells have changed. However, they are slightly changed. They almost resemble the normal cells in that area. Yeah. So there is what we call mild dysplasia, the slight change. Yeah. Okay. Now, the other one is grade 2. Grade 2. And with grade 2, as you can see, the cells are more abnormal and are moderately differentiated. Yeah, what we refer to as moderate dysplasia. In other words, from grade 2, they are tending to be more abnormal. Yeah, compared to the normal cells, they are tending to be more abnormal compared to the normal cells, and of course, this is also seen by these pathologists. As I told you, it is a specialty that actually you do after having obtained your bachelor's in medicine, or what we call MBCHB. You go for that specialty, and then you're able to, you know, to basically do that. Now, grade 3, we have, you know, cells are very abnormal and are poorly differentiated, as you can see in the slide. Yeah, so we are saying with grade 1, we are saying they differ slightly slightly from the normal cells. Yeah, and with grade 2, we are saying, they are continuing to be abnormal. Yeah, however, abnormal. However, they are what? They are moderately differentiated. You still remember what I told you about differentiation. Differentiation basically means the cells change to be exactly, or to function exactly as they are supposed to function. If it is the cells within the GIT, they are supposed to work just like the cells within the GIT. Yeah? That is what we call differentiation. Yeah, they differentiate into their specific functions. Yeah. Now, so in stage 2, they are abnormal, and they are moderately differentiated. Yeah, or what we call mild dysplasia. In 3, they are very abnormal, as you can see. In 3, they are very abnormal. Yeah, they are very abnormal and poorly differentiated. In other words, they are unable to perform the role or the function of what they are actually supposed to, or they are meant to do. Yeah, so that is what we call poor differentiation. And in 3, they are actually immature. Yeah, remember we said that. We said that they are rapidly growing. Yeah, so they don't get time. They don't get enough time to actually mature. They don't get enough time to mature, and as a result, they grow very fast, and then they are immature. They are unable to perform the functions that they are supposed to perform, and as a result, they are useless. Actually, yeah, they become useless to the body. They become useless to the body. Yeah. So we are saying that stage 4, the cells are immature. They are immature and become useless. Yeah, they become useless to the body. And actually, a cancer would not be a bad thing per se. However, because of the too much cell division, they basically consume all the nutrients, they consume, even the food reserves of the human being, and then they become deadly. Yeah, they become basically deadly. So with grade 4, the cells are basically immature, what we call anaplasia, and they are undifferentiated. They are undifferentiated. In other words, they do not resemble at any moment. They don't resemble the parent cells. Yeah, so they do not resemble the parent cells. Now, when we talk about staging, with staging, we want to know is the tumor located where where it is supposed to be, yeah? Or has it moved to other areas? That is basically what we mean by staging. Yeah. Now, with staging, we have stage 0, where we mean that the carcinoma is in situ. This is what we mean. We mean that if the tumor started within the lungs, then it is still within the lungs. That is what it means to have the carcinoma in situ. If it is within the liver, then by the time they do a biopsy, then it is still within the liver. Then that is, we call that stage 0. In other words, it is still located within where it developed. That is what we mean by a carcinoma in situ. Now, stage 1, so we have stage 0, we have stage 1, we have stage 2, we have stage 3, and then we have stage 1, we have stage 2, we have stage 3, and then you have stage 4. So basically, so with stage 0, it means that the carcinoma is in situ. In other words, the carcinoma is actually still located where it is supposed to, where it originated. Yeah, with stage 0, the carcinoma is in situ. Now with stage 1, we are saying that it is limited to the tissue of origin. Yeah, and it is localized. It is still localized within. Where it is where it was. Yeah. Now this is what we mean that we might have if I might show you here. Yeah, we might have maybe a tumor. Let me just draw an example of the lungs. Yeah. So if this is our lungs, if these are our lungs, yeah, these are our lungs. So we might have a tumor here. Yeah, we might have a tumor developing here within the lungs. Yeah. Now when that tumor develops there, when they do a needle biopsy, we are going to see what some of the things that they do when they are investigating cancers. But one of them is what we call a needle biopsy.